Modern medication did not work for me. Modern medication did not work for me. Modern medication did not work for me. Modern medication.
Welcome, callers, to Mercy TV Live, your medical cannabis call-in show. If you're interested, have any questions, comments, curses, kudos for medical cannabis, Mercy Center, or anything in between, give us a call at 503-588-6444. Greetings and welcome to Mercy TV Live. I'm Perry and I'll be hosting this with Sunny, this here segment of our show. And we've got a bunch of things to talk about, some very exciting things. PTSD has been added to the medical marijuana program, and we want to let folks know about all the specifics on that. Also, medical marijuana facilities, aka dispensaries, will be coming to Oregon, and there's a lot of questions about that and how that's going to work. But still, you know, celebrating cannabis, helping folks to get their card, find medicine now, to get growing or find a grower, and best methods on medicating, not just here in Oregon, but across America and around the world. So hopefully we can fit this all in here in this segment of Mercy TV.
Well, you know, Perry, we seem to get a lot of calls about a lot of different things. Lately, it's been the dispensaries and PTSD. And these are things that are very important to people because you want to be prepared. You're going to get your card. They just added PTSD. So what you need to do is get some of your medical records showing that you have PTSD together. Get them together today. That way, when you do see the doctor, you'll have all of your paperwork ready. You won't have to worry about getting it together and then seeing the doctor. You already have it together, and the main thing is you got now to get it together. Mm-hmm. And a lot of people have been calling about this and want to get to see doctor today, and doctor cannot sign you for your card today for PTSD. There is this January 1st thing that they're going to, so after January 1st, it sounds like then it will be added, then we'll be able to sign, so the doctors will all be able to give their blessing.
Yeah, in the meantime, of course, folks need to, as you say, get those records together. That is, if their regular care physician won't sign for them, because then they'll need to take those records to either Mercy Center or one of the other clinics that will sign for folks when their regular care physician won't. Of course, those who use cannabis until then and happen to have a law enforcement encounter will have to rely on their affirmative defenses, which is not as good as having the card, but it's better than nothing. So should you end up in that situation using cannabis for PTSD and end up getting into trouble, please contact us here at Mercy, the Medical Cannabis Resource Center, and we'll get legal resources applied to your case and get you out of that there trouble. In addition, you know, folks, there's other conditions that should be added to the program. The system wasn't really fixed for that. That's right. One of the, you know, we're glad that PTSD got through, but we didn't really solve the problem there. And that comes with the ACA, the Advisory Committee on Medical Marijuana, that's meeting this Monday, September 9th in Portland. Folks can go to mercycenters.org to find out more about that meeting. So and in that meeting, we'll be talking about these medical marijuana facilities that's happening, or dispensaries as folks call them. And a couple of things can hopefully come about also because of that. The 12-inch rule, you know, the fees, what it costs folks to get with the program, and some things like that too.
Well, and right now everybody's concerned about getting their card, getting their medicine.
Yeah.
We have a phone call.
Great. Hello, caller.
Hey, I was curious as to when PTSD patients can start getting cards.
It's officially January 1st, 2014.
Oh, all right. Thank you.
Okay, good luck to you, sir.
All right. Thank you. Have a good night.
All right. Well, see, everybody is asking about it because there's a lot of people out there using it. They know it works. They're trying to get around it, not getting in trouble by doing this illegal thing. But yet everybody's heard about all of the whole state going to be legal. And it is, but not till January 1st. but get your records together today so you can help yourself when it comes January 1st. And that's the only thing I wanted to make sure and get out to everybody. Please, just take the time, get your records together today so you're not forced to then.
Right.
And then it's all a big rush and you can't do it, because I imagine there's going to be a few people looking to get their records for PTSD. And in doing this today, you're ready. Comes around the first of the year, you already out. All you have to do is bring your records by and the doctor will see you. Then you will be ready and you'll get your card for the PTSD. Like Perry was saying, there's a lot of other things, ADHD and all of these other bipolar and all these other conditions that people use cannabis for that we talk to all of the time. Yes, it does work. Yes, there is not a solution for that today, but those are the things that we have to start working on, just like we did PTSD.
Yeah, because we were looking at the symptoms of it and getting it to treat that. So things like fibromyalgia, fibromyalgia itself is not a qualifying condition, but the pain from it. So unfortunately, folks have to wait until their fibromyalgia causes pain before they can get cannabis for it. The same with a whole raft of other ones, and that's not the way the program should be working. But if you out there, folks, get involved and help to, reinforce it and make it happen, then it would be better for yourselves and your loved ones that use cannabis for these conditions and more.
Well, there's a lot of people that I'm seeing, bro, that don't allow anybody else to know that they're using cannabis. And they feel that if they let anybody know that they're using cannabis, that it will make them like less of a person, not as trustworthy as a person, not as a good person. Well, you know what? Good people use cannabis. We do this show to show everybody that, you know what, it's time to get out. Everybody that's using cannabis should be able to freely use cannabis and know that just because you're using it doesn't make you a bad person. You're actually a good person that knew about it before everybody else did. Perry, these are the things that I'm seeing, and it's really hard after you've lived like this in a closet for so long to jump out of that closet.
Yeah, and it's such a double whammy for these folks on PTSD. They're already in that situation of anxiety and stress and all, and to take something that's currently made war on by the federal government, it's doubly tough. So if you yourself use cannabis for PTSD, you know someone who does, and it's not just veterans, it's folks have gone through a number of traumatic incidents, folks that work in emergency rooms, disaster response folks, a lot of family situations of victims of abuse and all. So, let's cut the crap and set these people free and end the war on them and their medicine. Now let's make it happen. More news for folks. I'm sure they've heard about the federal announcement of how the Justice Department is going to, quote, respect states' rights. In other words, they've set these parameters whereby individuals and groups that work within these parameters theoretically aren't going to have to worry about the feds. And it was about 8 items, mainly involving cannabis getting out of state, cannabis getting to kids, selling, and things like that. So we'll keep an eye on this and really look to see how that policy applies to us here in Oregon. You'd think that if they're going to respect states' laws, they respect our state law on medical cannabis. Of course, with that statement comes another thought. Why don't we change our hemp law here in Oregon to exclude the requirement to get the DEA's permission and then move forward with this policy statement that the feds are going to respect states' laws concerning cannabis? And then we'd probably see an end of the war here in Oregon. Once hemp crop is grown and harvested, I think it's game over for prohibition.
Well, and there's a lot of people out there today going, what is that going to do for me? What it's going to do for you is it opens up a lot of job opportunities in the economics of Oregon and all over the United States. The main thing is that we understand that there is this thing going on. Everybody knows we're going to be voting here in November next year, and cannabis is going to be legal then? Well, because everybody that has come by has talked nothing but good. They're all voting.
And that's big, that's huge. Thanks for mentioning that, because this November we'll have a chance to get rid of those folks that voted no on PTSD, that said no to dispensaries, that said said no to legalization, that said let's keep this war going, let's keep wasting money. And folks, by the way, your federal government is currently spending $100,000 a day on the war on medical cannabis alone. You know, it's gone to hundreds of millions of dollars during the Obama administration. In this time where we're cutting costs and everybody's doing without work and all this stuff, it's almost obscene that, you know, the only job you can get in America is hunting down potheads. That the only industry and thing we got going is that, you know. The DEA got $3 billion in 2012. They hired 10,000 people, you know. Where's the sequestering for them, you know? We got to make it happen. And the only way, one of the ways is for you to register, vote, and get everybody you know to do so also, and vote smart. You know, look at those folks that said no to PTSD for veterans and other folks. Look at those folks that said no to medical cannabis here in Oregon and so forth. That's the litmus test. That's the way we measure the folks that are politicians who serve special interests, or the kind of leaders that we should have there in our legislature, as well as judges and district attorneys, and in cases where police entities are asking for more money, you know, say, hey, lay off the potheads and we'll let you play with some more money, you know. Those are the kind of things that we have a chance to do here this November. So let's do it, folks, you know.
Well, and it's very important that we remember, whatever you said reminded me of the hospital. There's people in the hospital tonight watching this show, and you know what? Nobody's mentioned to them about the cannabis, about them eating some cookies, about them eating some pancakes, eating anything that would allow them to their nausea to be able to eat anything without puking, without being sick for hours on end, and then having to wait for the nausea to subside so they could try to eat again. And this is an ongoing battle with a lot of people in the hospital, whether it's their nausea, their pain. All of these issues can be helped with cannabis. I'm not saying it's going to cure it, but it will help. There are no side effects. So the side effects that people are living from all these conditions they have and the pills and stuff that they're taking, the side effects are terrible. And knowing that cannabis can help you, because it will help you eat, it will help you sleep, it will help you be able to have the nausea that you never can get rid of finally subside a little bit, where you can start to eat. Then once that happens, you know, we are recovering and healing, and in doing so, that makes you go, wow, this is really working. I didn't think, you know, all these things that people are saying is true, but you know what? It's working.
Well, it's a full cycle. It's a full health cycle, it seems to be. You don't eat well, you don't sleep well, you're, you know, dragging through the day, you're suffering in pain and everything. It's very, it takes a lot out of you, you know, trying to get through that and all. And so this cannabis can, you know, apply relief at so many levels to folks going through these things.
And it's back to eating it, rubbing it on you topically, because if you have bad joints, if you have arthritises and degenerative disc disease and any kind of broken bone, back, neck, arms, legs, you guys, you can rub this stuff on your body. It will give you some relief. You don't have any side effects from that relief. All you have is relief. Now, I don't know about you, but all the people that I've talked with, all the people in the hospital that are suffering with pain like that, what we're talking, would give anything to have some relief without side effects.
Right.
And the whole thing is, I don't care how much relief, because my pain is at 10 or 12 right now, and if you can bring it down to 10 or 8 and give me no side effects, I would happily do that, because that's where they're at. The side effects are so bad, people are putting up with the pain so they don't have to put up with the side effects for the pain that they're experiencing, and then having those pain pills that they take just like make it worse.
Well, that's an important thing Sonny's mentioning there, the side effects. First off, no one has ever died from cannabis aka marijuana, in the entire recorded history of humanity. So it's benign in that respect. In addition, the topical application, making the oil and putting it on by the skin, it totally removes you from the toxicity. You know, folks don't get high from doing that. But it is applied to their joints, the stiffness, the swelling, the pain, also the skin conditions and things that folks suffer through, you know, all positively affected by cannabis. And it's a crime that this new information is illegal as it is. So you, the folks out there, need to help get it out, spread it amongst your friends and neighbors. Mainstream media isn't going to share this news with anybody. It doesn't profit them to do so. They're paid to not let you know about it. So you need to get out there, get that info from us or others, and then spread it amongst your friends and family, people you care about, and apply it to yourself. You know, but that's an important thing to note that there's, you know, first off, the cannabis is benign, and then in this method of applying it, this oil applied topically is especially so. And it's relatively easy to make, this oil. Also the buttering, other things, other methods of applying the cannabis. So there's no good reason why folks don't get out there, get it, and apply it, really.
Well, in doing that, Perry, there is so many avenues that people are traveling with their pain, with their nausea, with all of these.
Trying anything and everything.
Well, because
gosh, you know.
MS patients, seizure patients, Parkinson's patients.
Intestinal, bowel syndrome, Crohn's, other things, you know.
All of those are terrible, and nobody realizes what kind of quality of life, because there is none. You're taking most people that have some quality of life, lose it with all of these things that we're talking about, and you know what? All they need to do is have a cookie, rub some oil on, maybe take a puff. Even this vaporizing that not very many people have learned about is the hot air, and the hot air is breathed in, and when you breathe in the hot air, you actually get the benefit, for migraines and all the headaches and all the bad neck and neuro issues that people have are very good with that.
And this is an answer to doctors who say, I can't prescribe smoke medicine, you know. Well, this isn't smoking, it's vaporizing. There are no carcinogens, there's none of that stuff that they say is going to cause cancer. Not that it does anyway, you know. There was a study recently come out that there hasn't been a case of cancer caused by cannabis, and again, in the history of mankind there. As well as the rumor lie, if you will, from the authorities that cannabis causes emphysema or COPD or any other airway or cardiopulmonary conditions, you know. So
it's all of the stuff, it's propaganda that they are promoting. And you guys, we are the patients, we're the guinea pigs, we're the ones that are literally getting it out. That's why we're doing the show. If you have people, if you have brothers, sisters, family, friends, you guys, you got to help them, educate them, because one of their family, one of their friends might be suffering. And the suffering we're talking here is terrible. It is so terrible. I mean, look at the PTSD, people committing suicide. There is so much bad stuff going on with it. And if they had cannabis, it would make all the difference in their lives. And you know what? If you could save somebody, anybody, whether you knew them or not, and you knew you could smoke something with them or let them eat something and it would save their life, wouldn't you do that? I mean, that's a pretty easy call.
yeah.
I mean, everybody that
You'd
I've
think.
talked to, believe that, man, if I could do that, that would be like cool. Well,
But apparently it wasn't so easy a call this last legislative session. As we're trying to get the bill passed, there were some legislators who said it'd be better for folks if they used alcohol to cure their, to deal with their PTSD and all. And not only the damage to those individuals, but to everybody around them by, you know, from the consequences of alcoholism, if you will. So again, we get back to this November, we can change that and replace these politicians who have this better dead than head philosophy,
Right.
you know, and we're going to see this, deal with this again, I think, this next session, because we still have the kids issue, you know, kids using cannabis. In New Jersey, they just had to fight to get it so that kids could use cannabis there. Other places, they're seeing that. We saw some talk of special conditions. I think there was even a bill proposed last legislative session that said that kids had to get 3 doctors to sign for them, and they had to do it, renew it every 6 months. They had to have all these other things on there because there's no way we can let these poor children suffer under cannabis, even though it's not going to kill them, you know. So we need you, the people, to help with this, to make sure that cannabis is available for your child, for a child you care about, when it comes to it, you know. That's an important thing and a very important issue that we're going to be dealing with again, I'm sure, past the, you know, in this November session as well as beyond. So, folks, be sure to stay tuned to us here on Mercy TV as we go over all these issues, you know, as time it goes through. In the meantime, though, be advised that you can get cannabis for children here in Oregon. You will need a parent's approval, a guardian's approval. There's another form that's involved, but it is available, and folks considering it should definitely look at it and not be afraid of the reefer madness, for sure.
Well, there's a lot more information out there now. A lot of people are doing shows and studies, and you guys, if you really want to take care of your family, of your children, and look out for them and give them the best quality of life that they can have, wow, look into some of this stuff and see that, you know what, there is something to this, or all of these people wouldn't be going through this, risking everything that they have behind this, because really all it was propaganda. And here we are today saying, you know what, you guys, you need to look out for your friends and family. Make sure that your brother and sister get some help, because they don't need you talking bad about them because they're using cannabis. What they need is you going, yes, you've been educated and you understand that cannabis is a medicine and it will work for a number of conditions. And you know what? That's all we're saying.
Right.
You can get some help. Do you really need some help? And are you tired of the propaganda that people have said before, where it's no good and it's going to hurt you, when we know that's not true?
Right. So let's quit catering to the lie that marijuana is evil, that cannabis is dangerous, that it kills, and of course that it has no medical value. That's not true. These are all lies, and we shouldn't allow people to suffer because of them. And the reason why this is suffering, though, is because people are profiting from them. That we talked earlier about the millions of dollars that are being spent on making war on cannabis prohibition. Well, that's going to people. That's going to agencies and groups who profit from this war. So follow the money, and let's, you know, take these special interests down. You know, we can make a difference, but only if we all register, vote, and vote smart.
Well, and these are the things that we're trying to do by telling everybody what's going on, sharing the information, not keeping it to ourselves and saying, you know what, you, by hearing it, might be able to help somebody too, because they don't have the information that we have. And there's a lot of stuff on the websites, on the well, on the Mercy website.
Right.
There's-
MercyCenters.org. Sure.
Well, because do you have conditions? Look on it.
Right.
Look
We've got a number of pages documenting these conditions and how to apply the cannabis to it. We get communications all the time on the best applications and best strains for the cannabis medicine. And the reason is because it's not the THC that does the most good, it's the cannabinoids, the CBD, CBN, CBCs, and those are just the ones we know about. And here in the community, we're starting to identify which strains have the most CBDs, which works best for this condition, which one has the most CBNs, which works best for that condition. Also, the best ways to prepare your cannabis and utilize it, because a lot of our folks, they don't want to get stoned. They don't want to get couch locked, and they're concerned about all that. So these methods of topical application, and when you're producing your cannabis to reduce the amount of THC, and other things like that. So these are the things we work with at Mercy Center all the time. And if you're interested in any of this, give us a call. Folks can come on down to the office, right?
Come by Monday through Friday, 12 to 6. There's always somebody there. Everybody there's a volunteer, they're a card holder, and they're just looking to help somebody figure out what to do about their getting their card, their growers, whatever, getting some medicine, cooking, oils. Everybody knows that they can help somebody. All you got to do is come by and talk about it.
There's also a Wednesday night meeting, Wednesdays at 7 p.m., again at 1745 Capitol Street Northeast. And the website we mentioned. When you come to the Mercy Center, you can get the Oregon Cannabis Connection as well as the Mercy newsletter, both valuable pieces of information. We also have voter registration, by the way. But the OCC has recipes and other things.
Yes, every month when the OCC comes out, they have recipes. If you'd like to learn how to cook with cannabis, this is a nice opportunity to be able to learn some others already tested and tried recipes that will work and will help you at least guide you along some of your first cannabis dishes. These are very important, especially if you're the one with the nausea and need to help get something to get down to eat that you can keep down and that will help you. And these things have found to be very good for everybody that's eaten them because they've never had such good, healthy stuff in their system. And that's what they needed was some cannabis to do it, bro. And if you can do that and help, please come by, talk to us, give us a call, get a hold of us on the website at
www.mercycenters.org. There you can send us an email, leave a comment on the guest book, or see our phone number and thereby just give us a call and get your question or comment through that way. Another thing we want to let folks know about is something that folks have been asking us for a number of years, pretty much ever since the law came into effect here in Oregon. How can I get insurance? What if I get robbed? Won't my insurance cover it? It used to be that no insurance companies would. They didn't want to get involved. But now there is an insurance outfit that is willing to insure people's gardens, not just against being robbed, but against crop failures or even being raided. So that's a tremendous opportunity. It's Agent 420, and folks can find out more by visiting agent420.biz. And please check it out. Not only patients, but if you're a grower or if you're a cooperative, if you're a group of growers, there's several plans available for folks there, finally, now. So our kudos to Agent 420 and their progressive courage, if you will, in helping folks in this area.
Well, because up till now, nobody's helped. Everybody's been out there on their own, and that's not cool. All these people needed was a little help to make it so they can provide some medicine, and that's all that's needed, you guys, is a little help, and your quality of life will be better with cannabis, Perry. And that's what we're trying to give them the opportunity with all these things we're telling them.
Well, for better or worse, the Oregon system is one of networking. People must give to each other here. And we'll see some change with that when the medical marijuana facilities come through in March of 2014. But until then, and even when it is, we'll still have networking of the people, by the people, and for the people. And to find out more about that, the center of that, we expect to be here at Mercy Center. Mercy, the Medical Cannabis Resource Center, practicing common sense compassion here in Oregon, across America, and around the world. And giving out the news and information that you, the people, need to act and cement this law, and let's progress into the future. We're going to have to wrap it up here now, Sonny. Thanks for helping me out here on the show.
Hey, thanks, Perry. And remember, if you need any help, come by and give us a call.
Our thanks to CCTV and our crew helping us to help out you. Kudos to them. Thanks for stopping by, but it only works if you tell somebody about it.
Right.
Really, we need you folks to get out there and spread the word.
Hey, if you need anything, give us a call. We're there Monday through Friday, 12 to 6.
Right. Stop by the office or visit us on the web, www.mercycenters.org. There you can see past episodes of Mercy TV and get all the news, facts, and information. Send somebody a link. Spread the word. Thanks for coming by. We'll see you next time.
You want to say anything before I turn it off, Glenn?
Yes, good night.
Good night. God bless you all, every single one of you.